Hi folks, it's Marvin Music with Erica Smiley, and
Hello.
we're with MedicareSchool.com, and we want to welcome you to this edition, our live stream tonight, where we're going to look at a subject, and then we're going to take questions. And we're excited to be able to answer your questions about Medicare and Social Security. And before I get into our topic, I want to mention that if you'd like to start putting your questions in now, you can. Put them in the chat. Our producer, Daniel, will be screening those questions and getting as many of those to us as possible. I usually wear out of about an hour and a half, so I'll try to hang in there that long. And Erica's traveled today. She just got into the office, and I've been with people all day. So we've had a full day, but we are really, really excited to be able to be with you and help you. You may have some questions about what's going on for 2026. Happy to field those questions, other issues going on in your life with Medicare as well as Social Security. A couple things about the questions. Be sure that we can understand them. Sometimes people try to be brief, which we appreciate the brevity, but don't be so brief that we cannot understand what you're asking. Okay, so that's the only rule. And then two more things. If you're not a subscriber to our YouTube channel, we'd love for you to do that. You'll see Erica on there a lot. She does a lot of content, great content that is helpful for Medicare. At least 2 videos a week now, and so you can always be contacted when we put new material out, and that's one of the benefits of subscribing. So we'd love to have you be a part of that channel. Obviously, no cost, but I always tell people it's important to make sure you're on top of things with Medicare, but you can also be a great resource for others. People have lots of questions, and we're all in that kind of age group where that is a big topic, and so you can be really a great resource to help people to make sure they're making great Medicare decisions. And so there's really a twofold benefit. You'll make good decisions, but keep others from making some kind of big mistake, and those happen really all the time. Okay, so that's that. And then also, if you're coming into our Facebook group, hopefully you're a member of that. I think now we're maybe, 60,000 or something like that in our Facebook group now. And it is a group of experts from our company that will contribute, answer questions, but then others that are on Medicare that have experienced all kinds of things. So there's some great input from them as well. So we'd love for you to join our Facebook group and be a part of that community. Okay, enough said. Tonight's topic is really about
your birthday.
Me. Yeah, my birthday is coming up. I turned 65 in January, and I have had a lot of people ask me what I'm going to do. And I'm going to tell you what I'm going to do. And by the way, what I am doing won't necessarily be the best option for you. So, one size does not fit all in this business. There really are a lot of options. But I am going to tell you what I'm going to do. I am definitely going to enroll in Medicare A and B when I am eligible to do so, which is now. I start in January. I want to mention before I get into what I'm going to do, there are some of you that you're approaching Medicare eligibility and you're still covered by a wonderful group plan. Now, by the way, we have a group plan here, but I'm one of the owners of the company and I know what it costs. And so I don't want my partners to be paying for my stuff. So I am definitely going on Medicare for sure. But if you have a good group plan, and I think we have one here, it is, but I know the cost of it. We pay for all of our employees. But a good group plan that has a very reasonable premium cost, to you, that has a fairly maybe a low deductible, that you're happy with your plan, you're happy with the network, and it's working for you. Well, then just know, as long as there's 20 employees or more with the company on the payroll, not on the plan, but on the payroll, you don't have to do anything at all with Medicare. A lot of people are confused by that. What do I have to do? And so, again, if you have a good group plan, that's and my rule of thumb is if it's costing you maybe $250 a month or less, and it's a good plan, then that's probably a pretty good value. Wouldn't you agree to that?
Yeah.
Yeah, I think it is. So that's a good price point. But if you're on a mediocre plan, a lousy plan that's expensive, then Medicare could be a good option. We have a lot of people who call us actually and ask us, will we give some advice on that, whether they should be on a group plan at work or should they go on Medicare? And we are happy to have that discussion with you. But just so you know, what we would have to know and what you're going to have to know to really make that decision is, what does it cost you, number one, to be on the plan? Number two, what's your deductible, and do you ever meet that deductible? Is the deductible ever an issue? And so if you're on a deductible that's $2,500 a year and you meet it every year, well, take $2,500 divided by 12, and that means that it's costing you just $200 a month for the deductible plus your premium. Medicare may be a better value than that. Thirdly, we want to know your max out of pocket. What's the most you would spend if you had cancer or some serious health issue come up? Sometimes that's 10 grand, 15 grand. That's very high. And then also your medication cost. How are those covered? And so those are the things that we look at. And when you share that with one of our agents, I promise you we'll be truthful. If you have a good group plan and it makes more sense than Medicare, we'll tell you. And if not, we'll tell you why. Now, one thing that we find sometimes people have maybe mediocre coverage, not the best even price, but their spouse is younger and is on the plan, or their children covered up to age 26 are on the plan. And so sometimes you have to stay on those group plans just because of other family members. So we would never encourage someone to go to Medicare if that is going to be a negative impact for their family in any way. But sometimes Medicare makes sense. And so you just have to make that comparison, and Glenn would be delighted to do that. All right, so that being said, I'm going on Medicare. Now, I'm not on Social Security yet. I am still delaying that, of course, because I won't hit that for a couple more years as far as full retirement age goes. In fact, right before I came into this office, I just enrolled a guy into Medicare, A and B, and Social Security at the same time. Keep that in mind. If you reach out to our company and you want our services, we are happy to do a Social Security application at the same time. Sometimes people want to do that, and I certainly did that for him. Takes an extra 20 minutes or so, but keep this in mind that if you do take Social Security and you still plan to work, you cannot make a lot of money. There's a thing called an earnings test, and so just be aware of those kinds of issues. You can make all kinds of investment money and rental income and pension income, but not wages. Wages are what they'll test until we hit full retirement age. All right. So again, I'm going on Medicare, and so when it comes to plans, I'm like you. I have some options. I could do A and B only, I could do A and B with a supplemental plan, or I could do an Advantage plan. If those three options, the worst for sure is A and B only. Sadly, I think right now what about 10% of all people today are actually choosing to be on A and B only. And if you're even contemplating that, I hope I can encourage you, don't do that. That's silly. It's risky. It's really, quite frankly, crazy to do that because the amount of risk that you're assuming. No doubt. I had a guy today call me, Wichita, Kansas, had a friend that had A and B only and went through a serious health issue, no joking. $2 million worth of bills. $2 million. Yeah. Okay. So by and large, cost about 20% out of his pocket. And he was loaded, but that's all he had. And so that's unfortunate for someone to have A and B only because of the risk that you incur. And so the other options in remaining, A and B with the sup or with an Advantage plan. And so I'm definitely going to go with a supplemental plan. Those of you who've watched me for years and probably knew I would say that, but I'm going to do a supplemental plan. And the reason I'm going to is because, number one, I can afford the premium, and I'm choosing to afford it. I know some of you are on Advantage plans and you could afford the premium of a sup, but you don't want to, and that's fine. We're all different. But I like the features of supplemental plans, and I'm willing to pay a premium for that. And those features that matter to me, number one, I can go to any doctor that takes Medicare. I will never have a pre-authorization by my insurance company, and I have a permanent policy that can never ever be canceled unless I don't pay for it. And so that's worth something to me. I had two people in the office today, been with me for several years, and they just were shopping and looking at rates. And they said that the majority of their friends are on Advantage plans and basically mock them for paying a premium. Why would you pay a premium when you could get something for free? And so they have been educated, and they said, because we know if we get sick, we know we're going to have quality Cadillac coverage, and that they're willing to pay a price for that. And that's free. Me as well. That's right. Yeah. And really, you always get what you pay for almost in everything in life. And I'm not bad-mouthing Advantage plans, but the topic is, what am I going to do? And I'm going to do a supplemental plan because I see the benefits of it. I think it is well worth my money. Now, I do want you to know that I happen to live in a state where rates are fairly high. They are. I live in the state of Missouri. And the reason they're high here is in Missouri, we have what's called an anniversary rule. The anniversary rule is very similar to the birthday rule that's around about a dozen states today. But the anniversary rule in Missouri says that on the anniversary of my policy, which mine will be January, 30 days before my effective date, anniversary date, and 30 days after, I'm in a window where I can move my supplemental plan like to like. I can't go like to less. If I go with the G, which I will, I could go G to G. I can't go G to N, but I can go G to G on an annual basis, 30 days before, 30 days after my policy anniversary date. And during that window, there's no underwriting required. I can pick any company that I want, and they have to approve my policy. That's called the anniversary rule. And because that rule exists in the state of Missouri, that drives the prices up substantially. You know, what's interesting to me, Erica, I find there's a lot of states that are going to the birthday rules, and from the consumer standpoint, I think the insurance commissioners think they're really doing everybody a favor. And they are doing sick people a favor, but they're not doing the general population a favor. But I live in a state, I don't set the rules. The insurance commissioners have always in Missouri for years had this anniversary rule. And so I'm gonna have to pay for that. It's gonna be in my premium. Okay, and so what I did, I ran some rates before I came on air here, and if I were to get the same G policy in Kansas, where our office is, we're in Overland Park, Kansas, that does not have the birthday rule or the anniversary rule, but just has regular attained age policies. Those policies in Kansas versus Missouri are about, what would that be? There's a G.
Yeah.
The lowest G right now in my area is actually we'll just round up, it's $206. That's the lowest G plan in Missouri. Right above that is $212. We go $222, $242, $243, $250. So the point is, in my state, G plans right now, our low side was $205, high side among 6 carriers here is about $250. So about a $45 difference in the G plans for someone male turning 65. Now, lady here would be about $10, $15 lower. Also, this price included a household discount. I'm married. My wife's above 50, and so we get an additional discount because of that. So the whole point is that's where the market is in Missouri. Now, if I was right here, and we live not very far from the state line, but on Kansas side, those same G plans, look at this. Low side was about $148. So that is that's about $50, almost $60 cheaper. So it's $148 on the low side, and actually there's one at $132 in Kansas, because this company gives a 20% household discount, meaning if husband and wife were on the same company, they don't have to be on the same policy, but the same carrier, then that's quite a nice discount. So my whole point is Kansas is a good $70 a month cheaper. And so whenever you live in a state that has these birthday rules and all those things, folks, insurance companies build that into the price. All right, so that would be G plans. 205 to 245. If I was in Kansas, 132 to $200. So a lot better value. Okay, now I did look at in plans. I know some of you are going to go in plans. And by the way, today I wrote 4 MedSup plans. I wrote 2 Ns and 2 Gs. And the couple that had the in plan, they actually were on Gs. And so they were approaching. In fact, they were above 70 actually. And we moved into in plans, and I thought that was a great decision. Mm-hmm. They saved about $70, $80 on their premium. Anyway, so the point is, if you decide to go with an in, I do not think that's a crazy decision. I think it's a fine decision. Now, those of you that are new to this and are wondering what's the difference between a G and an N, well, why don't you explain that? That'd be good for you. I've been yakking.
And I was going to say, too, the N plan is getting more popular. I looked up an N plan in Ohio today. $89 for a plan N. So yeah, really low premium. So pretty much an N is just a step down from a G. So you're still going to be responsible for that Part B deductible, which this year is $257. That may go up next year. But on top of that, you're going to have to pay some copays. So maybe up to $20 when you see a doctor, possibly up to $50 when you go to the emergency room. But they're small copays. So if you don't go to the doctor very often, that's not going to add up too quickly. The The last thing is there's something called excess charges, and this is really the only major difference between a G and an N. If a doctor is non-participating or if they do not accept Medicare assignment, they could charge up to 15% over the billed amount, and you would be responsible for that if you had an N plan. And now sometimes that can scare people. They want to shy away from it because of that, but it's very rare. I think it's less than 5% of doctors in the whole country that charge these excess charges. There are 8 states where it's not even allowed. So I think it's Connecticut, Minnesota, Massachusetts, New York, Ohio, Pennsylvania, Rhode Island, and Vermont. If you live in one of those states, an N plan might be a very good option because they're not even allowed to charge those excess charges. And again, it can always be, you can plan ahead with that. Just ask the doctor or ask the surgeon, do you all accept Medicare assignment and are you participating? So yeah, very few differences. You know, it's just a step down from the G, and you can save $50, $60, $70 possibly, depending on where you live. Yeah.
Agreed. And
Yep.
so that was the case in Missouri as well. It was about $50 on average. And so that's $600. And sometimes that can make a real impact in someone's budget. And so it's a very good choice. I think right now, if I'm not mistaken, about 60% of all people still going with G's, about 40% going with N's.
Yep.
So there really is no bad decision there at all. I think they're both fine plans. And again, I favor supplemental plans because, number one, I've been in this business 17 years. And I can tell you, I've never had a single complaint with someone that was on a supplemental plan, ever. And I cannot say that about Advantage plans. I can also tell you this: what's interesting about our business, and we have lots of clients, and through the years, I have written a lot of people in the healthcare profession, a lot of doctors, primary care docs, specialist surgeons, a lot of nurses. Even people, coding departments, and I've not one single time ever had one of them request to be on an Advantage plan, not one single time.
No.
And the reason for that is because, they're in the know every day. They see some of the difficulties people face with pre-authorizations and network issues and all those kind of things. And so the whole point is, it's kind of like, I describe it like a mechanic. I'm not a mechanic. In fact, I'm far from a mechanic, but I know mechanics can normally tell you when a timing belt's going to go out, if they still have those, and when this is going to go out. And they just know. Mechanics say, I'm not going to buy that car because of the engine or whatever. And they're under the hood every day, and they know what's going on with those with the mechanics vehicle. And so people in the medical professional, they're under the hood. They see the mechanics going on with some of the issues and frustration that people face, with their healthcare selection. Sure, folks, zero looks great. It does. I like zero, but you're not getting by with zero if you have cancer. You're not getting by with zero if you have any kind of a health issue. You're going to pay as you go on that Advantage plan. So I would just soon be pretty well done on that G plan, or an N plan would be a good option as well. Okay. Yeah. And again, I'm not here to beat anyone up that has an Advantage plan. That's not my point. I'll have people they'll chat in and say, I've been on one for 10 years and it's worked great. I'm glad. I want it to work great for you. But there's been plenty of people that have had some really tough experiences with pre-authorizations, especially in post-acute care. Post-acute care, folks, is the one thing that really can cause these Advantage companies to lose money. It's the most expensive thing there is. Not hospital care. You'd think it would be, but they'll bundle all that. But post-acute care is $550 a day. And so if they're getting $1,000 a month or $1,100 a month and they're spending $550 a day on you for 20 days, all of a sudden they're upside down. And that's why they control post-acute care. And I can tell you story after story of people being prematurely discharged from a skilled nursing facility when they should have stayed, but they didn't get to stay because the Advantage plan said, no, you're done. Against clinical evidence, against doctor's advice, you're done. They're not going to pay for it any longer. And that happens all the time. Okay, and there's a reason that very few skilled nursing facilities today want to take those plans: low pay, slow pay, or no pay. All right, and so I know all that, and so that's why I'm saying I made the decision. But again, it fits in my budget. I can afford that. So please, someone who cannot afford a Medicare supplemental plan, can't afford these rates, I wouldn't get one. I wouldn't. I would buy an Advantage plan, get on Advantage plan, get the very best one you can that's available in your particular market, because I've seen people that could not afford supplemental plans get them, and usually 2 months, 3 months, they're out of them. I've had people who couldn't even make the first bank draft. Yeah. So there's no reason to do that. If you can't afford it or you don't want to afford it, then Advantage is still tons better than having A and B only.
Yes,
Okay,
for
all right.
sure.
And let's talk about drug. Oh, go ahead.
Let me ask you.
Yep,
Well, I was
ask.
going to ask about dental and vision, because a lot of times we have people say, "Well, maybe I'll keep my employer dental and vision." What's your plan when you turn
Well,
65?
of course, I don't have anything at work, so I already have a dental plan, so I'm going to keep my dental plan.
Okay.
Yeah, I have emeritus. But anyways, we write a couple different dental plans, and really within our practice, about 50% of the people that we write med-sup plans get dental, and 50% don't. So I think it really boils down to your teeth. Frankly, I've hardly ever used mine other than get cleaning because I have great teeth. My wife, she uses it regularly. We get our money's worth out of her.
Yeah.
My kids as well. So the point is, I think dental is important. And I will tell you this. The more I learn about the importance of oral health, it's critical that you take care of your teeth. And sadly, that's one thing that ages. And so I think dental plans are good. Yeah, we write them now. I think most of them are about $3,000 annual benefit. We have one that we just picked up for implants. It'll actually cover, it's a year waiting period, but after that, it'll cover up to $10,000 a year for implants. That's awesome coverage.
Yeah.
All right, so I think dental is important. I was going to mention one other thing about coverage when it comes to drugs coverage. I don't take any meds. I hope I never take any meds, but I will still get a drug plan. You know that. Tell them.
Yes.
Why am I going to get a drug plan? You tell them.
They're going to make you get a drug plan, or you're going to get a penalty, probably. Yeah. So when you do enroll in Medicare A and B, unless you have creditable drug coverage through an employer plan, which you're not going to if you're going the SUP route, then you have to have a Part D drug plan. So a couple reasons for that. Yes, one, of course, you don't want to have late fees and penalties, right? The government will give you a 1% penalty for every month you're not on a drug plan, and that will compound and add up. And then outside of that, you just don't know what's going to happen health-wise. I mean, we say all the time, there's no crystal ball with health. You could be perfectly healthy today, and heaven forbid something happen next week. And some of the people we talk to, they're on medications that are thousands of dollars.
I had one today, $33,000.
Yeah.
$33,000 a month.
Yes, that's crazy. I had someone on a plan, when we put it in where it wasn't on formulary, it was something like $83,000. It's crazy, some of the costs of these medications. So you wouldn't want to be with no coverage at all. And it's the same thing like with auto insurance, right? No one ever thinks they're going to get in a wreck. We hope we don't get in a wreck, but we have to have the insurance and coverage there just in case. So you definitely want to get a Part D drug plan. If you're with an Advantage plan, that Part D, that drug coverage is usually included in that Advantage plan. But if you're going to go the A and B and the supplemental route, we'll help set you up with a Part D drug plan.
Yeah. Get a drug plan. Even if you take no meds, you need one. I love the cap that's on Part D plans now, $2,100.
Yeah.
So this guy that's on a $33,000 a month medication, it's Stelara. Now some people take about half the dose he takes, so it'd be about 15, 16 grand, but he was 33 grand. And so, but he'll only spend $2,100 in 2026 the whole year for that medication. Okay, and all of them have it in formulary. Yeah, they have to cover it. So I shouldn't say all of them. Every plan I looked at had it.
Yeah.
So anyway, so I'm gonna have a drug plan now. My market, the lowest cost drug plan is $9.60 a month, and it's a good plan. This year that plan was $0, and it moved to $9.60.
Yeah.
So caught some people off guard, but it's still very, very low cost. And just so you know, you all, GoodRx is awesome. Single Care, great, awesome. Mark Cuban's Cost Plus Drug Company, very good, but they're not drug plans. There are definitely great ways to save money on some generic medications, but when it comes to expensive brand names, those plans are not going to hardly help you at all. That's when the Part D plan comes into effect. Okay.
And there are still a lot of states where we do have $0 premium drug plans. So a lot of people are surprised. They're like, why doesn't it cost anything?
Yeah,
but they're
good.
generic meds, a lot of them are $0. The plan's $0. So yeah.
Good. All righty. Well, I'm going to get a G, and I'm going to get a drug plan. And I'm excited to go on Medicare. I've been in this business 17 years, so it's now my turn. So, all righty, that's it. Let's take questions.
All right,
We're
let's
ready.
take questions. All right, let's see what we've got here. All right, Carol's asking, is my reasoning correct that if I know that I'll reach the $2,100 cap and a plan covers my drugs, it doesn't really matter what the copays are? I should just look for the lowest premium.
Okay, any answer?
Yeah, so on this one, Carol, so when you call us, we're going to work with you and make sure we ask you your medications, ask you, what dose you're taking of those. I mean, you obviously want to get the most the best plan for you, right? So yes, we want to make sure we know your medication. They're on formulary. If you're going to reach the $2,100 cap, you're going to reach the cap. Maybe it just might take a little bit longer if we get you better prices on those meds. Also, we can plug in your pharmacies as well too. There's standard pharmacies versus preferred pharmacies that can help you save money. But yeah, you still want to make sure, we'll match up to the best plan if you give us a call, that all your medications are on formulary. But yeah, if you're going to hit that 21 cap,
Yeah, I agree. Just take your lowest cost plan.
Yeah.
The only difference would be this. Let me add this, and that is that when someone is paying $50 to $100 a month, they have a broader formulary. So medications in the future may not be in that formulary. That's going to be cheaper.
Yeah.
Okay, so that'd be the only risk. But what I do, what you're thinking, Carol, I would live in the present. Just deal with what you have. But that'd be the only negative, is if you had a basic formulary and then you had a med that was prescribed throughout the year and it was not in formulary.
Yeah.
You could get a formulary exception, or the 2100 is not going to apply.
Yeah, and that money you pay for the monthly premium, even if you have a plan that's $80 a month, that doesn't count towards the 2100.
No.
It's only the money you pay for the medications.
Yeah. So Carol, yes, that's the answer.
All right. Steve says, many thanks to Brock for doing such a fine job. Yes, Brock's a great guy in signing me up for Medicare and securing the plans we needed. So yeah, just a shout out to Brock there.
Yeah. Hey, Brock came to our company and was a total rookie, but hard worker, smart kid, just a great guy. So we've had several like that knew nothing about Medicare and came into our system. In fact, sometimes we like it when they don't know anything.
Yeah.
Then we don't have to undo all their bad habits they get from other companies. But we appreciate the encouragement here about Brock. He is good.
All right. Carol asked, do I need to sign up for anything if I intend to remain on my husband's insurance for 3 more years? I have extensive health pre-existing conditions.
Okay. You don't, as long as your husband's employer has 20 people on the payroll or more. That would be the only criteria, because if there's 20 people or less on a payroll, then you have to enroll into Medicare A and B to put Medicare in the first payer position, and then your company plan would pay second. But in this scenario, if indeed there's 20 or more, then your husband's plan would pay first anyways. You don't have to do anything at all with Medicare A or B, so you're fine. So long as he keeps working. And the key, Carol, to this also would be, let's say if your husband were to change jobs after some period of time, you want to make sure that you never have any kind of a gap in your insurance coverage. There has to be active employment and insurance by that employer, not COBRA. And so that's the real key to being eligible to come into Medicare in the future with no penalties or no problems. Once we hit 65, so if you're covered by his plan, I don't know how old he is, and it doesn't matter, but for you have to have credible coverage all the way back to 65. Okay? So that would be my one caution, and you're fine to do it though.
We have a lot of questions about company-specific, like dental plans, stuff like that. We just want to address
Okay.
that question when people are asking about specific.
Okay.
Related to any plan.
Pardon me?
Related to any type of plan,
Okay. Well, we had several questions, I guess, in the chat are people asking about specific companies. So a couple things about companies. It really varies market to market. I had a guy I'm working with that just signed up out of Massachusetts, and basically there was one company. And there were 2, but one was not very good and one was competitive. So folks, it really depends. Sadly, I had a lady today, I was on another call in, and she is from New York. And there was one HMO plan in her market, that one HMO. There were 3, but the other ones did not cover any of her doctors. She had one plan to choose from on an HMO. And New York is an issue because they're very costly. Again, where the insurance commissioners think they're doing people a favor by having all these rules that really hurt people, drive insurance businesses out of the state. But they're very, very expensive in that state. So you all, I'm going to answer your question, but I want to make sure you know when it comes to carriers, this varies. In my state, right now, in fact, Missouri and Kansas both, when I'm helping people locally, I'm looking typically at about anywhere from 6 to 8 different companies, and that's about it. Now, we have about 12 companies to look at in our quoting engine, but some of those are regional carriers, regional. And I'm not interested in regional carriers because they're too small. They don't have a large enough market share normally to give stability of premium, stability of rates to our clients. So I want national carriers. So we're typically looking at Cigna, Aflac, Aetna, United Healthcare, Medico, Mutual of Omaha. Who else comes to mind? But
Humana.
Yeah, Humana. Yeah. So the point is, when it comes to med sup plans, we're looking typically at national carriers, and the reason for that is because they all have a pretty decent market share, and the risk of those health claims is spread out to to more companies. So that's a criteria. Now I want to explain something about Cigna. Cigna was acquired by a company called Healthcare Services Corporation earlier this year. They paid $3.3 billion for them. And so what they're doing is they're rebranding their business. Now, Cigna was known as Cigna or Cigna HealthSpring, both names. And so what HCSC has decided to do is to rebrand all of that book of business as HealthSpring. And we've had a lot of people ask about that. Well, should I get off because of that? No. I think Cigna's been a very good company, very stable through the years, just as stable really as anyone else. And so I don't think HCSC has bought them to come in and bring turmoil to their book of business. Why would you pay $3.3 billion for a company and want to come in and do something drastic? Where if they do something drastic, people leave the plant. So I don't think that's going to happen. So if you're with Cigna, I think you're still in good hands under this new ownership. I really do. But again, you can always switch if you want to. But the point is, those are some of the big carriers. Now, when it comes to Advantage plans, United Healthcare, Humana, HealthSpring, WellCare, Aetna. There you go. So again, almost all your carriers that are in the med sup business also have Medicare Advantage plans. And with those, I don't get hung up on companies. What I care about are your doctors in your network, are your hospitals in the network. Now, if I have, there are some of those carriers I like versus another, but the bottom line is I want to make sure my providers that I can see who I want, my medications are covered well. I'm happy with my max out of pocket. So I look at not so much the company, I'm looking at the features of that plan because most of them are very, very similar when it comes to Medicare Advantage plans. All right, so hope that helps. Drug plans. There's, again, a handful of companies out there. Again, to me, it's not the name of the company. I care about formulary. Are my medications covered? That's really what matters.
Yeah, I was going to say, and Daniel brought up dental and vision as well, too. He named some of it, correct? Emeritus is a big one. Cigna, Aetna, same thing. Another company, NDC, we do for, which is now MetLife. So a lot of different carriers for that as well, too.
Yeah, and really when it comes to your dental plan, it's nice to know what does your dentist like and take. That's nice if the dentist will do file the claims. If they won't, most of the plans are PPO. You can go where you want. Just you pay the bill and then you get reimbursed for those.
Yeah.
Okay.
All right. Okay. Michael says, I have an N supplemental plan. Can I change to a G sup plan during open enrollment without underwriting?
Okay. Well, first off, just so you know, open enrollment has nothing to do with supplemental plans. It's not. Open enrollment that we're in right now, October 15th through December 7th, is all about Advantage plans and prescription drug plans. Okay, so it's not about subs. And so during the open enrollment season, you don't have any additional rights that you would have any other time during the year when you have a supplemental plan. The only issue with supplemental plans during this period of time would be if you want to move to an Advantage plan. This is the only time you can do it. But sup to sup, you can do it any time of the year, but you have to go through underwriting. So you're saying, will they waive it because of open enrollment? And the answer is no, because open enrollment has nothing to do with supplemental plans at all. Now, it could be that you live in a state that has what is called a birthday rule. And this is a period of time around someone's birthday, normally 30 days before, 30 days after, maybe birthday for the next 60 days, but we have these different windows and it varies. And if you live in a birthday rule state, then around your birthday, you can move supplemental plans normally like to like or like to less. That's G to G or G to N. If you live in a birthday rule state, those would be California, Oregon, Washington, Idaho, Nevada, Oklahoma, Missouri is anniversary rule, same concept. Illinois, Louisiana, Kentucky, Maryland, Virginia, Rhode Island, Minnesota. So in other words, we have these about a dozen states where you can do that around your birthday. But if you're healthy, you can move anytime. But if you're unhealthy and you want to move, then you're going to have to restrict it then to the birthday period of time. But no one can go from an N to a G. That would be moving up in coverage. You could go N to N, but you couldn't go N to G. It's like to like in most states, or like to less as well. Okay, Illinois, you can do it 65 to 75. Got to stay with the same carrier. Louisiana, you can do it anytime, but you got to stay with the same carrier. So we're starting to see some of these birthday rules, states saying, but you got to stay with the same company.
Okay.
Okay. All right. So no, you can't. Not into G.
Okay. Will your representatives tell us about all the plans available in our state? I'm in Alabama. So yes, Christopher, we will. And that's really the thing with working with a broker, and that's what we are at Medicare School. So we're not really tied to one carrier or going to push one kind of plan. So really our whole objective is to educate you and tell you about all your options, whether that's SUP or Advantage, or whether that's an Advantage HMO or a PPO. So yeah, when you call us, we're going to talk with you and just kind of talk about both directions, see which way you want to go, ask you about your doctors, ask you about your medications, and get you the best plan. So yeah, we'll give you all your options in your area. And one thing I like to tell people, because it's natural for us to want to shop the best price, but actually the carriers set these rates. So I tell people, if you go to that carrier directly, or if you come to us, you're going to get the same rate as well. So yeah, we're going to always give you your options and let you know everything available in your area.
Yeah, we'll discuss stability as well.
Yeah.
We have the records on the stability of that company. We'll share that with you.
Yeah, for sure. All right, Sharon says, I'm on disability and will be turning 65 in February. What do I need to do? I'm dual Medicare and Medicaid.
Okay, very good. Well, Sharon, if you're already on Medicare A and B because of your disability, and you may be, then you have a chance to start all over again. We call this the IEP2. And so again, if you're already on Medicare A and B, so in February, 3 months before, 3 months after your birthday, you still have this opportunity to be able to kind of reset the clock and really do whatever you want. So you may live in a state where you can only get a Medicare Advantage plan. Many states are like that. Most people live in states that do not allow you to get supplemental plans, just Advantage plans only. But if you happen to live in a place where you can get a supplemental plan, usually the rate's higher than someone that is turning 65. So again, you can get a new one at that time. So you open this window to do whatever you want. And so as far as what do you need to do, if you're just brand new to Medicare, meaning that you've been on disability but you were not on that full 25th month, then what's going to happen is they're going to mail you your card. In fact, the card should show up October, right? November, December, January. Yeah, so your card should have shown up in the mail in October. If you're turning 65, you're on disability, the card should have shown up in the mail. Hopefully it did. So if that's the case, then you don't have to do anything. Now, when it comes to being dual eligible Medicare, Medicaid, then what most people do in your position is they will get what is called a dual SNP plan. That means dual eligible Medicare, Medicaid, but it's a special needs plan designed for people that have dual eligibility, and those would be Advantage plans. And there's a variety of them, and all the companies offer them really all over the country. And they come with some really nice packages, very low cost on drugs, a lot of copays, very low, max out of pocket, very low, because what's happening is Medicare is paying, but also Medicaid is paying as well. So we write those plans, Sharon. If you want to call in and tell the switchboard operator that you want an appointment, then we actually can set an appointment to help you get on that plan. You can call in right now. Our office is open until 7 p.m. tonight. And just going to ask them to share with you information about dual SNP plans. We'll take your medications, your doctors, and hospital choices, and we can shop that to see which would be best for you in your market. Okay, you're in that time. It's time to do it.
Yep. All right. If I have FEHB, Basic Blue Cross, is it better to get Part A and B and a supplemental and D? I'll let you take that one, Marvin.
Okay, sure. Okay, well, when it comes to FEHB, you're in a very unique position. And by the way, everyone else, the FEHB just stands for Federal Employee Health Benefits. And this is someone that's retired from the government, their civil service, retired IRS, FBI, Homeland Security, or whatever. And so when you did your basic blue, you're getting about an $800 credit from Blue Cross Blue Shield that will help you cover some of the cost of your Medicare B premiums, because with basic blue, FEHB is now going to pay second. So Medicare pays first, FEHB is going to pay second. And by the way, if someone's watching and you have GEHA, it would be the same setup. They also give the $800 credit. And so you're asking, is it better to get A and B of a supplemental plan? Here's the issue. For some people it is. We write FEHB people all the time on regular supplemental plans. And the reason is because the cost of them being on FEHB is just not very attractive. I just shared my rates with you on a G plan, and what we were 205 to 240, and the N plan was 160 to 175, 180 or whatever. But the point is, if you're paying $250, $300 or more a month for your Fed Blue plan, it's just too much money. And so then a supplemental plan would make sense. Now, we got to keep in mind, is your spouse on the plan? How old are they? All that, of course. But if we're just looking at comparing dollars to dollars, it just depends on if you're paying too much for your FEHB plan. And we see plenty of people that are. And you can call in and we can go over all those rates with you. But here's the issue. When you enroll into that supplemental plan, you also have to disenroll from FEHB, and it's permanent. And so you're going to have to be comfortable with that. Now, if you're paying a lot for it, you're not going to be bothered by that. But if the FEHB is still very competitive, then you're probably not going to want to enroll in a supplemental plan because you disenroll. Now, when you disenroll from FEHB, it is permanent. But what happens is that premium that you've been paying for your Fed Blue in this example has been coming out of your monthly annuity check. And so they'll stop that. So you don't have that money coming out. So your annuity check actually is going to increase. And so if it makes financial sense to take a supplemental plan, then I wouldn't be troubled by that at all. But if FEHB is still a good value for you, probably not going to do that. So what we find a lot of folks are doing today that have good attractive rates and good plans with FEHB, they're taking what is called an MA only plan, MA only, which means Medicare Advantage only. You keep your Fed Blue plan, you get your drugs through there, and then Fed Blue will actually coordinate with a Medicare Advantage plan. And the benefit of that is because you're getting your drugs through Fed Blue, FEHB, then the Medicare Advantage company will give you a credit towards your Part B. So not only is Blue Cross Blue Shield giving you a credit, $800 a year, the Medicare Advantage plan will also give you a credit, and that's going to range anywhere from $100. I just wrote one the other day, it's $100 a month. Next year it's $150 a month. Yeah, why? Because you're getting your drugs through FEHB, and that Advantage company is not responsible for you. All right. Now the good thing about this option is you have both of it. Both coverages. You have Fed Blue and you have the Advantage plan. Now, what some people are doing, they'll actually suspend FEHB and just take a normal market Medicare Advantage plan. And so that also can be very attractive. So you have a lot of options for sure. But you're asking me, is it better? It's only better to get rid of FEHB if you're paying a high rate for that. Okay, $300 a month or more, then yes, I think it's better.
Okay. All right. Okay, next question here. I think we might be frozen up. Yeah.
I don't like to look at that guy froze up for sure.
Yeah. Gets us in those great faces. I see one up here, that we could answer right here. While he works this out, I see somebody ask, is the Part B premium going to be $206.50 next year? And we don't know that exactly yet. That's the number we've heard kicked around some, but we don't know the exact numbers. What do you think? Maybe in a week or two, hopefully we'll know.
I don't know, but I think that's the people that make these estimates, I think it's going to be close.
Yeah, yeah.
I do. I think it's a pretty good estimate.
Somebody asked downside to high deductible GE.
Downside?
Yep.
Okay. So someone can our audience see that question, Daniel?
They cannot at the moment.
They ask us about what's called a high G plan, high deductible G plan. What are the downsides? High G simply means that you have to meet a high deductible before your supplemental plan ever pays. Medicare will pay, but the supplemental plan will not. And the deductible this year is right at $2,900. And so you have to meet that deductible before your time pays. So the premiums are very low on those, but the downside is you got to meet that deductible. In fact, if you had one hospitalization, you will spend more money paying for that hospitalization than you would probably all year long for your plan.
Yeah.
Certainly an N plan and even a G plan. So
Yeah.
to me, I don't think they're that great of a value. I really don't. Now, if someone wants to get it, do I think it's crazy? No. The downside really is to get off of a high G. With most companies, you have to medically qualify. There's some that'll give you maybe a couple years to do it, but if you stay on that high G long term and then want to get off of it when you get sick, now you have to medically qualify to make that move, even if you live in a birthday rule state.
Yeah.
So I'm not a fan of them. I'm not saying they're terrible by any means, but it wouldn't be something I would do.
Okay, if I have a retirement group vision and take a Medicare supplemental plan that has vision, will I be double covered?
Okay.
Well, yeah.
Well, yeah.
I was going to say, yeah, you're not going to find a Medicare supplemental plan that's going to have vision. So they don't include vision with them. That would be an Advantage plan if you did that. But yeah.
Well, let me just add to that, though. Okay, and you're right. You're right. But listen, keep in mind, when you have a supplemental plan, it's going to fill in the gaps of original Medicare A and B. And original Medicare A and B has excellent vision. Excellent. The only thing it doesn't cover would be eyewear and preventive eye exams. Other than that, it covers everything. Glaucoma, cataract surgery. I just had a detached retina. It'll cover that. I mean, it covers great. So your supplemental plan is going to cover vision because you've got the gaps in Medicare. Collectively, you've got great coverage. And so what Erica is referencing there is that a vision plan that someone gets beyond a supplemental plan would be for eyewear and preventive eye exams. And folks, listen, if you're seeing I see floaties all the time at our age. So you're gonna see stuff. You're gonna have vision problems. So your eye exams will be covered. You just can't go in and say, "Hey, doc, are my eyes healthy?" Well, that's not covered. But doc, I'm seeing some floaties. My vision seems to be off. If it's truthful, then that's covered. Right? And everything else is going to be covered. So I would say that your retirement group vision, number one, it's cheap. So if you do have eyewear, since Medicare doesn't cover that, then I would keep it.
Yeah.
I would. I think it's fine. You're probably paying, $10, $12 a month, maybe at most for it. And if you do wear glasses or contacts, you'll probably do well there.
Yeah, and that's what I was going to say. For comparison, I think a lot of the vision plans we quote to people start around $11 a month. That's going to get you money for glasses or contacts every 24 months. So yeah, if you have an employment plan, it's going to compare for sure.
Yeah. And to answer your question, you're not double covered there, really.
No.
Yeah, you're not,
Yeah.
because those group plans are going to, cover the eyewear and preventive eye exams. Good question, though. Anybody else?
Okay, can I have an Advantage plan as first payer and VA TRICARE West as a second payer?
Okay. VA TRICARE West. Well, number one, I've never heard of VA TRICARE West. We know what TRICARE is. And so TRICARE is going to pay second to original Medicare. So what you can do, if you want to, if I'm understanding what you have there, because I'm not going to focus on VA, we're going to talk about just TRICARE. What happens, a lot of people in your position are enrolling into what are called Medicare Advantage plans only, MA only plans. And what happens is TRICARE will coordinate with the Advantage plan, and yes, it's first, and then TRICARE will pick up really any of the remaining copays. Just like TRICARE would coordinate with A and B. And why a lot of people that have TRICARE are doing this is because when you enroll into that Advantage plan, you get a sizable credit on your Social Security check, number one. That's called the B give back. Why? Because you're going to use your TRICARE for your meds. And then you get some of the perks that come along with the Advantage plan. And that would be a gym membership, a dental allowance, hearing aids. Those kind of things are nice, over-the-counter type benefit. And so if I were you having TRICARE, I would not do a supplemental plan. To me, that's too much insurance. That doesn't make any sense. So I think the MA only plan is a very good option. Okay, I do.
Yep.
So the answer is yes, to your question. But I never heard it called TRICARE West.
All right. Next question. To anyone who knows, I am just starting Medicare A and B. Do I need to re-enroll in A and B each year? So no, you do not need to re-enroll in A and B each year. It's one-time enrollment. What you pay for A or B each year could change. There's something called an IRMA. So those are year to year. They're always going to look 2 years back at your modified adjusted gross income from 2 years previously. But no, you enroll in Medicare A and B one time and they'll send you your Medicare card and you'll have that. Now, depending on which direction you decide to go with your Medicare benefits, some people go the supplemental route. And the supplemental plans, they're kind of set it and forget it. They have a lot of that convenience that Marvin talked about where you don't have to do anything with those yearly, right? So your supplemental plan you'll have forever unless you don't pay your premium. Then they can take it away from you. We do tell people maybe every 3 to 5 years, you might want to reshop that supplemental plan. If you have an Advantage plan and decide to go the Advantage route, now those are more calendar year plans. Those can change from year to year, and you do need to pay attention to those plans. That's what we're doing right now in AEP. It's the busy time of year. But as far as re-enrolling in A and B, once you do that once, you're set up and good to go.
Yep.
All right, I've decided I want a Medigap policy, but I'm having a little trouble deciding on which provider. How can I research patient satisfaction with Medigap providers? I'll take this one because I talk to people who are worried about this a lot, right? So we're always looking at service. Like we want a company that's going to take good care of us and give us good service. But it's interesting, when you talk about these Medigap and supplement policies, you really don't deal much with having to deal with customer service because you're really not getting a bill. Once you hit that $257, that Part B deductible, you're not having to haggle with things like prior authorizations and referrals, and it's pretty simple. So we always tell people we look at a couple of things. Obviously, we want to get you a good rate, so we're going to look at the rates, but Marvin had mentioned rate stability, and that's probably the most important thing to look at. And just, Medicare School, they've been dealing with Medicare for years, 15 years, helping people. We know which companies are going to be rate stable. The prices are going to go up each year because of Medicare inflation or medical inflation, but you want to get with a company that's going to have smaller increases, not huge increases. So Mary, I wouldn't worry so much about the actual customer service or patient experiences with the company, because a lot of times when you just look up Cigna or Aetna or United Healthcare, it's hard to know that person's review. Did they have an Advantage plan? Right. Did they have a supplemental plan? Or did they have employer insurance? And really what we tell people, if you call us and we help set you up, we'll be your customer service for life. So we actually want you to call us. All of our customer service team is here in Kansas City. We don't outsource that to other countries. So really, people with Medigap plans, Mary, like maybe they'll lose their card and they need a new card. We call the carrier on your behalf and help you with that, right? So there's just not a lot of red tape and not a lot you have to do with the Medigap plans. So I would make your decision based on best rate stability, more even than looking at their reviews or patient satisfaction. Would you add anything to that, Marvin?
No. Other than your best rate, what she means by that is the initial premium. Mm-hmm. Yeah, that initial year's rate that you're going to be paying, that matters. Mm-hmm. And sometimes the lowest could be the best, but maybe not. And that's why the stability really, really matters. So, no.
Yeah. I think people worry about, are they going to pay? Are they going to cover? Yeah. And really, anywhere Medicare pays, the supplemental plan has to pay.
That's
so,
right.
And any doctor, you don't have the networks, in and out of networks to deal with, so there's just not as many headaches and customer service things to worry about.
Yeah, I tell people truly, there's not a nickel's worth of difference among the major carriers as far as service goes. Mm-hmm. Yeah, they're all going to pay the same bills. Same type of bills, same amount of bills. They're not going to fight you. They pay very quickly. Medicare pays fast. Medicare pays within like 2 to 3 weeks, and supplemental plans shortly after that. Mm-hmm. So initial premium, rate stability. That's what matters.
Yeah, but Mary, call us. We can give you your options in your area and help you take a look at that. All right, Cindy wants to know, but isn't the case that if we step down to a plan N, we can't go back to a G without medical underwriting, even in a birthday rule state?
Go ahead.
Yeah, that is true. If you go down from, like to like or like to less, once you go down from that G to the N, you would be in an N. Now, you could always shop for a different N, probably, if you're in a birthday rule state, but that is true, Cindy. Once you step down from a G to an N, you would be there with that N.
That's right.
Yeah. All right, Medicare School has been a big help finalizing my Medicare choices. Everything was completed in one friendly and helpful phone call. Amazing service. Good. Well, thank you so much. Happy to hear that. So
Appreciate that.
yeah.
It's encouraging.
All right, William's asking, some supplements offer gyms. Yes, that is true. Are they only offered with an added charge? I'll let you take that one.
Okay, sure.
Yeah.
Sure. Yeah. Well, the only one that I would know that would come without an added charge would be Humana. And most of the markets that we've looked at, Humana, have not been real competitive, have not been as rate stable as what I would like. And so I'm not bad-mouthing Humana at all. I'm just saying to you, they would typically have a Silver Sneakers membership in some of the Humana plans. United Healthcare also offers gym memberships in some of their plans. In some states, they have two options, one with or without. So clearly, when they are offering both, you are paying extra for that gym membership. So that would be an issue.
Yeah.
And then in some markets, Blue Cross Blue Shield Anthem will actually have an add-on where they will allow you to add on Silver Sneakers to that at a kind of at a reduced price. So you're asking at an added charge, and I would say to you, no. I think all of them that include it, there's going to be some cost that's built into that premium to get that covered. Okay.
Yep. All right. Does the state of Texas have an anniversary or birthday rule for supplemental plans? No, they do not. Just looked that one up the other day.
Yeah,
So that would just be if you want to switch supplemental plans there, you would have to go through medical underwriting.
Yeah, and let's talk about that for just a quick second. I don't know if you're with us during the opening segment, but I live in Missouri, and we don't have a birthday rule, but it's anniversary rule. Same concept. It's just tied to the anniversary of the policy than to my birthday. But we pay for that. State of Texas has very, very good rates, and they don't have the birthday rule. So I was making the comparison between Missouri and Kansas right now. We're actually paying about, I'm going to pay an extra $70 a month to be able to have that right. And the majority of people would rather not have to pay $70 extra a month. And so Texas has just made the decision, no, you have 6 months of your B date, get whatever you want. Then after that, going to have to medically qualify to switch. Okay.
All right. I had the pleasure of speaking at length with Josiah Music last Monday, and I now have a supplemental plan and a Part D drug plan. He was very informative. Happy Medicare School, new customers, 65 female in Florida. Josiah better do a good job. He knows some people around here, huh?
That's great.
Yeah, that's Marvin's son.
Josiah is my son. Yeah, I have 3 sons, 4 daughters, and 2 of my sons are here.
Yep.
Yeah, we work together, and what a blessing that is. So thanks for the encouragement there. We'll tell Joe.
Yeah,
he's a hard worker.
Yeah, he is.
He is actually our #1 agent, just so you know. And he works. We have some great agents, all of them, really.
It runs in the family. So, all right. Can you talk about age attained versus community pricing and how to know which one you're getting? I'll let you take this one, Marvin.
Okay, very good. Well, the difference in how you know what you're getting would be community pricing is always higher, always. And I'm talking about monthly premiums. So I just gave you rates here in Missouri, and let me just pick one. I'll make the illustration. The lowest in Missouri on a G plan right now, Medico 205. Kansas is lowest was 132. Okay, so what, $70 difference. So Missouri is an issue age. You didn't ask about that, but we throw one more into the mix. Missouri is an issue age. Kansas is an attained age. If you're in New York or some of the East Coast states, a lot of those up there are community rated. And the difference is community rated means everybody that lives in that area, community, which would be zip code or county or even a whole state, everyone gets the same price regardless of age and gender. Okay, so that drives the price up, which means the 85-year-old gets a bargain, and the 65-year-old is paying a lot more than they would have to anywhere else. So again, community pricing is always higher. Attained age is the lowest, and the reason for that is because we start low, and this is what Kansas is. Remember, I said mine. Lowest in Kansas right now was 132. Lowest in Missouri was whatever I said, 205. Sorry about that, 205. So a difference of $77. Because in Kansas, it starts lower because all the insurance carriers, companies, have the right to raise that rate up a little bit every year. It's about $50 for the whole year divided by 12, so it's $4 or $5 a month. And every year it's going to go up a little bit. And the reason for those increases would be to offset group increases. So an attained age starts low, community starts high. Both of those can have group increases, but community is not going to go up every year because of your birthday. Why? It already started so high anyways. So attained age is your lowest option, bumps up a little bit because of birthday. Missouri, attained age states, and I think there's only like 4 or 5 of them, not many of them, but they're kind of right in the middle. And so your age matters when you first get the policy. That's issue age. And it matters then, but then the price can't go up because of age, but it will go up because of group. And so people ask us all the time, what is better? Folks, it's not about what is better. There is no better. Number one, usually the insurance commissioners of the state decide how the insurance companies are going to rate them. So they decide. So what's better is how much of a market share does that company have? I would much rather have a large market share attained age policy than a smaller company that has issue age policies and doesn't have a good market share, because that's not going to be stable. Because remember, all of them go up. All 3 pricing methods go up the same way when it comes to group increases. Money goes in the group, money goes out through claims. So money goes in through premium, goes out through claims. And as soon as there is more money going out in claims than is coming in through premiums, that insurance company is going to ask the insurance commissioner for a rate increase to get back to where they started. It may be 4%, 7%, 10%, whatever it is, but every single pricing method is going to have group increases. Okay, so I like attained age. I wish I lived in Kansas. I really do. To me, that's better. I'm having to pay $70 extra because of an issue age policy.
Yep.
That's right.
All right. After your enrollment date in Part B, how long do you have to select a Part D policy without a penalty?
Okay.
So, yeah, Rick, it's 63 days. 63 days that you have before you need to get a Part D drug plan, or then you'll start getting a penalty of 1% per month.
No.
Does that line up?
No, that's not right.
He gets me on some of these.
That's
so
not right. You're
correct
very
me
clear.
here, Marvin.
You would be right
Okay.
if we're talking about coming off of an employer-provided plan.
Okay.
Okay, that would be true. But here's the thing. Let's use me as an example. I turned 65 in January. That's my birth month. Okay, the next 3 months, which would be February, March, and April, I can still enroll into a drug plan, and that drug plan will start the next month. So my last month would be the last month of my IEP, if I'm coming in at 65. Now, if I'm coming in off of an SEP, then that would be true within 63 days.
Gotcha.
Make sense?
Yeah.
So you were half right.
See, Rick, I learned something every day.
Yeah.
So
And I have people ask me this all the time that don't take any meds. How long can I put it off? Well, if you're coming in at 65, you can put it off that 3rd month of your IEP. So for me, I take no meds. So my birthday's in January, February, March, April. If I enroll into a drug plan April, I'm still fine without penalty, and my new drug plan will go effective May 1. After that, penalties would start. If I was coming off a group plan, I'm 67. Now I have 63 days of having lost that credible drug coverage to start a Part D plan. So you were truly half
I
right.
think you threw me on that one, Rick, because I always tell people, don't wait and put it off. You need a Part D drug plan. So, but yeah, thank you, Marvin. All right, hopefully we answered your question there, Rick. All right, Tommy, how do you get a formulary exception? So you have to have your doctor write a letter, correct?
And now the companies are letting you do it as well. So here's what I would do. If you need a formula exception, you call the plan, customer service number, and ask them what is the process, what's the paperwork involved with the formula exception. It used to always have to be the doc only, but I've been told now the plans will actually let the insured do it. I've never seen the form, but they can actually ask for a formula exception as well. I don't know how that goes, but maybe docs were not responding quickly enough. I don't know. Yeah, but each plan will have a process. And you can do like us. You can chat GPT and it'll probably tell you.
Yeah. And Tommy, if you haven't looked at drug plans for next year, we have a call every day at 2 o'clock,
Yeah.
right? 2 o'clock Central Standard Time. If you haven't looked at plans for next year, if you can't get that exception this year, make sure you get on a plan for 2026 where your medication is covered on the formulary.
And I want to add this too. My experience has been the companies are really good about adding those. And remember, it's just for the plan year. It's just for you. It's not for everyone, but they're good at it. Now, I had times when maybe they were asking for a brand name formulary exception, and it's a new diagnosis, so they may make you try a cheaper med, a generic equivalent or alternative. That's called step therapy, but they're really good about it. Yeah, they are.
All right. Okay, how does Medicare work if you have to go to a walk-in clinic, especially Plan G? So really, any doctor you go to, you need to make sure they accept Medicare. So any doctor that accepts original Medicare has to accept your G plan. And that's what's great about supplemental plans. You're not going to have to worry about networks like that. So really just check and make sure they accept Medicare patients, and 98% of doctors do. So you shouldn't have any problem finding a walk-in clinic that takes Medicare and your G plan.
That's right.
Yeah.
Just give them both cards, A
Yeah.
and B and G. And they'll file the claim, and you don't have to give them any money. If they ask for it, you don't have to do that. They'll file the claim, and then MedSup plan will follow and pay their part, that 20% co-insurance. All right.
All right.
Should be seamless, really.
Yeah. I have insurance with my company and plan to retire at 66 when I will apply for Medicare. If I'm laid off after I turn 65, will I still have a number of months to apply for Medicare without underwriting? So really, you never have to go through underwriting to apply for Medicare, A and B, but you may be referring to a supplemental plan. So the way that would work, Nancy, if you would get laid off for some reason when you're 65 and a half, right? When you get laid off, you would have an SEP, which is a special enrollment period, and you would pretty much have 8 months after you lose your group coverage to get enrolled in Medicare with no penalties. Now, what you're talking about underwriting, that's the Medigap OEP. So that's a 6-month window where you can get a supplemental plan with no underwriting, and that's going to line up with your Part B start date. So that doesn't matter if you start Part B when you're 66 and retire, or if you start Part B earlier because you would get laid off. Either way, you're going to have that 6-month window when you enroll in Part B to get a supplemental plan with no underwriting. Okay.
Yeah, and I would just add to that, when Erica mentioned the 8 months, it is true. You have 8 months once you've lost your group plan, but you never want to take that 8 months, ever. Because if you would be on COBRA then, and so folks, when you retire, you want to make sure that you go on Medicare A and B immediately, because she's right. You have 8 months to delay taking Part B, but while you do that, you're going to be covered by COBRA, and then COBRA only pays second. You pay first. So I hate that rule, but they give us 8 months to enroll. So when people make a mistake, we're glad we have the 8 months. But 8 months is very dangerous.
Yeah.
And so Erica was right. There is no underwriting to get into Medicare, but those supplemental plans, 6 months, a B date. So hopefully that helps. Okay.
All right. I have a supplemental and drug plan. When I go to check other plans recommended by you by text, they tell me I would be better off on an Advantage plan. I have been a client for years.
Okay, let me tell you what's going on there. Okay, because that system, I'm assuming, Ellen, that system has asked you a few health questions, and so when we don't believe we can get you through underwriting, then they may be recommending that you look at an Advantage plan if you need to switch. We're not saying that you're going to be better off on an Advantage plan versus your supplemental plan. We're saying that if you want to switch, we can't get you through underwriting, and if you want to, Advantage would be your only option. So I'm sorry for the wording on that, okay? So we still love supplemental plans. As long as they're affordable, then stay on the plan that you're on for sure, Ellen. But if you can't afford it, then since we can't get us up, Advantage would be your only other option. That's what we mean by that. And I'm going to check on that. Daniel, We need to find
Yeah.
out. We've had that come up a couple times, and I'm really sorry for the wording on that. Yeah.
All right. Mr. Herbert wants to know, is there a way to look at the relative size of a different G providers, since you said the larger pools of people are better tempered for price increases?
Yes, yeah. Most of the carriers do report this information, and we can actually look at how many policyholders are in that market. Okay, so that information is out there, and most of them will report that. So when you talk to one of our agents, you just tell them you want to know about that. Okay, and by the way, hey, let's talk about ACE. ACE is backed by Chubb, which is an awesome company. But ACE made some kind of transitions in this business. But I had a lady in yesterday, actually, that was with ACE. And we shopped her rate. And of all the carriers, there was only one carrier that barely beat ACE. So they were still very competitive.
Yeah.
And so here's my point. As long as your rate is still competitive, I would stay with ACE. It's not like they're not going out of business by any means. They just changed some of the structure of their company, the name, and all that kind of stuff. So, but as far as size goes, again, talk to our agent. We have that data.
Yeah, I was gonna yeah, they've changed their name, but they've still been coming up very competitive when we look at those supplemental rates, for sure. All right, next question. I'm retiring February of next year and will lose my employer insurance. Do I have to do anything during open enrollment now, or can I wait until late December? Yeah, you don't have to do anything now. So if you're retiring in February, you're going to probably want your Medicare to start March 1st. So yeah, you won't need to do anything. I would probably maybe mid-January enroll and let your employer know that you're going to be obviously ending on that employer plan at the end of February, and let Medicare know you want to start on March 1st. But you don't have to do anything right now. No.
I would do something right after December 7th.
Yeah.
Yeah, just wait till the open enrollment period's open. It's very extra busy right now for everyone. You probably were not going to get quite the attention you deserve until after December the 7th.
Yeah.
Plenty of time.
I was going to say, we can look at those supplemental plans anywhere from 3 to 6 months out. So if you think you want a supplemental plan after December 7th, book an appointment with us, and we can always look at those and give you some rates and some information. All right. How do you prevent a company from continuously raising your Part G plan premium where it's much higher than the market? It seems like they could force you off their plan.
Mm-hmm. Yeah, well, you can't prevent it at all. What's happening, just so you all know, these companies, they just can't go randomly and raise a rate $60 unless they have proven to the insurance commissioner of your state that they're losing money, because those premium increases are approved by the state insurance commissioner. They are. Now the attained age, they can raise those every year because of birth date a little bit, but these big group increases you're seeing, those truly have been approved. And so what's happened is either that company didn't have a good market share, which I would suspect is very possible, or they just experienced a tremendous amount of claims. They just have, and that's where the market is.
Yeah. I was going to say, and if you're in a birthday rule state, you could always shop around your birthday for another G plan or an N, or you could call us, whenever. If you think you could get through medical underwriting, we could help you look at other companies if your rate's getting too high.
Yeah, and you can go to Medigapcompare.com as well if you're just kind of curious about where rates are. And let me explain about that site. That we own that site. And when you go there, what it's going to do, it's going to give you the lowest 3 carriers in that market. Okay, it's not going to give you all 12 or 15 that we're looking at. It's just going to give you the lowest 3. And so it will show you. And so if there's some that are lower, it'll give you an opportunity then to be able to answer a few health questions and see if you can go ahead and switch.
Yeah.
It's a great site. A lot of people use it. And it's all really self-service there.
All right. I would like to travel when I retire. RV life. Nice. Is there a best national plan? So really, yeah, I would say any supplemental plan. So if you get original Medicare A and B and you have a supplemental plan, you can use those in any state as long as that doctor accepts original Medicare. So the Advantage plans, those are going to be more local plans where you have to stay in or out of network. So I would definitely go with the original Medicare A and B and a supplemental plan, whether that's a G or an N. Either one, you can use that when you're out in the RV.
Yeah, that's right. Yeah, anywhere you go in the country, you have A and B and a sup, everyone knows how that system works. Seamless, folks. Seamless, it really is.
All right, we plan to get indemnity insurance for hospital and critical illness such as cancer. When is the best time to get these plans or riders? Can you help me and my husband enroll in these plans? Yes, definitely, for sure. So, Geraldine, if a lot of people don't know what she's talking about, hospital indemnity is something that just helps with your co-pays. Should you be hospitalized and have co-pays? Critical illness plans are fantastic. Can be for a cancer or for heart attack or for stroke, and those are plans that are fairly inexpensive, about $20 to $30 a month usually, and they will pay you out a lump sum payment if you have a diagnosis. So, Geraldine, obviously the best time to get these plans would be now when you're healthy, right? Because you have to be healthy. You can't have cancer and get a critical illness cancer policy. But yes, we can absolutely help you with those. When people call us and talk about enrolling in Medicare and setting up their Medicare plans, that's something we actively talk with them about, those critical illness plans and those hospital co-pays. So yeah, just call in. If you're a current client already, even our customer care team can help you with that. But if you're not a client yet, just go to medicareschool.com, book an appointment with us, and we can absolutely give you quotes on those.
Yeah, and there's no underwriting on the indemnity plans, the hospital
No.
ones.
Yeah.
I don't know what ages, but I think that as long as when you first get on Medicare, you can get indemnity plans.
Yeah, a lot of those are guaranteed issued up to age 79. We've got
really?
one,
Oh, that's
yeah,
good. That's
for the
really good.
hospital indemnity. Yeah.
And folks, people buy those to cover their hospital copays on Advantage plans.
Yeah, you really don't need one with a supplemental plan, but that critical illness plan is great because there's a lot of costs that people don't think about outside of medical bills. So if you have a heart attack or a stroke or cancer, you might have to travel and stay in a hotel while you travel, or make changes to your home, or fly a family member in, have somebody do your lawn and cleaning and watch your dog, all that stuff. So that's where that critical illness policy is good. You can use that money for whatever you want, and it's tax-free as well, too.
It's good.
Yeah, I got a basic one.
All right. What is the difference between Advantage and supplemental plans?
Take it.
Basic, but not basic, right? Because there's big differences. So they're both going to fill the gaps of Medicare. Marvin was saying before, like, really, your least option, the one that leaves you at most financial risk, is just staying with Medicare A and B. There's 6 gaps when it comes to Medicare A and B, and it leaves you at a lot of financial risk because Medicare is going to pay 80% unless it's preventative, and then you have to pay 20%. So that's why people add an Advantage or a supplemental plan. So the difference is just how they work. Advantage plans, they can have $0 to very low monthly premium. So they're more as a pay-as-you-go system. You may pay $0 to have that Advantage plan, but every time you go to the doctor or need an x-ray or an MRI or you're in the hospital, you're going to pay as you go, okay? Those are more local plans, so they're going to be in-network. You don't have to worry about if your doctors are in-network or out of network. Marvin said we don't dislike Advantage plans. They're a good fit for some people, but they have a little bit more red tape. You have to sometimes get referrals to see specialists, or you have prior authorizations where you have to get things approved. So those are kind of some things that happen with Advantage plans. They're also not portable. If you move from one state to another, you have to get a new Advantage plan that fits that local market. Or the supplemental plans are the opposite. So a supplemental plan, you're going to pay a monthly premium. So, Marvin said it depends on where you live. Maybe it's $150 in your area. Maybe it's $200 a month. But then they're very comprehensive coverage. Outside of that monthly premium, with a G plan, all you pay is the Part B deductible. So it's the first $257, and then you're done for the year. So they're very much peace of mind where I'm paying this each month. I know my expected expenses, and then I'm very well covered. Also, there's no networks with those. You can see any doctor that accepts original Medicare in the country. You can travel and go to different doctors. You don't have to deal with the prior authorizations and some of the red tape. So they're just a lot easier to kind of deal with, especially if you have a major medical event, cancer, anything like that. They're just comprehensive coverage. But it really depends on what's your budget. Can you afford a supplemental plan? A lot of people, if they can afford it, they like to go the supplemental route because there's a lot of freedom with that. But if it's not in your budget, the Advantage plans are still going to give you some comprehensive coverage. You have those copays. They have a cap, right? So you're not going to have a $500,000 bill. You're going to have a max out of pocket on that plan, and you'll know what that is. You just need to know your doctors need to be in network network if you want to save money. If you go out of network, it may cost you more, things like that. So that's some of the major differences with the Advantage plans and the supplemental plans. And really, that's what we do. Our guides educate people. So if you don't know, there's a workshop. Marvin does a workshop that you can get on our website, medicareschool.com, and it really does a good breakdown of Advantage plans versus supplemental plans and how they work. And then if you call one of our guides, we have a presentation also. We can pull it up and really walk you through and help you make a decision on which one's best for you.
That's right. Good.
All right, are non-formula medications not included in the max out-of-pocket for the year for Part D? They're not. They're not included, and they're not covered. So that could be really, if you're on a very expensive medication and it's not on formulary, they would not cover it or pay for it at all. So you want to make sure we can get on a Part D plan. Whether you work with us or you work with someone else, make sure they know what medications you're on, what the doses are, so they can help you find a plan where your medications are going to be on formulary.
I just want to add that when it comes to the max $2,100 for next year, yeah, that's the only rule. It's got to be in formulary. You've got to get those meds through the plan. Yeah, that's it. So, hopefully you'll be able to find a plan that will cover your medication.
Yeah.
But sometimes there's some out there that no plan will cover.
Yeah.
And the reason for that is because there's alternatives out there that are less expensive. So.
All right, please confirm that any provider who accepts Medicare that Supplement Plan G has to pay after the deductible. Yes, that's true.
Exactly right.
Yeah.
Yeah. Confirm that any provider who accepts Medicare, the supplemental plan G has to pay after the deductible.
Where Medicare pays, the supplemental plan will pay.
Yeah, we can confirm that. I will tell you this, that there are some primary care practices that will not take supplemental plans. And the reason for that is because they are owned by the Advantage company.
Like a Kaiser.
Yeah, well, could be Kaiser.
Yeah.
I'm just saying. I know that there are large PCP groups that will not take a supplemental plan.
Oh, okay.
They only take Advantage because they're owned by the Advantage company.
Okay.
So they're servicing Advantage members, and so they will not take supplemental plans.
Okay.
Yeah, most people will never encounter that, but I'm just wanting to make sure that you know that if you're going to a doctor that says they're not going to take the supplemental plan, it's because the Advantage company owns them.
Yeah.
And that's few and far between. But yeah, we can confirm that as long as that provider takes original Medicare, they will take your supplemental plan, and after the 257, you have full coverage. Yeah, we can confirm that. So.
All right. When enrolled in Social Security and turning 65, are you automatically enrolled in Medicare? How do you enroll in a supplemental plan, including Part D, if no open enrollment period? So yes, you are correct. If you're taking Social Security before you turn 65, you're going to automatically be enrolled in Part B. So they're going to send you a card about 100 days out.
A and B.
A and B, yes, A and B. You'd probably already be on Part A since you're on taking Social Security. Correct.
Well, they're turning 65,
Yeah.
though. That's
Yeah, turning 65, yeah. So, like, if you were already taking Social Security, like, if you started taking Social Security at 62 or 63, you might already have a Part A card. But when you turn 65, oh, I'm sorry. That's why Marvin keeps looking at me. Hey, if he could kick me under the table right now, he would. I get it. When you're enrolling in Social Security at the same time as A and B at 65, yes, you're going to have to enroll. If you're going to enroll in Medicare and Social Security at the same time, you have to go online and enroll. So you can do that either at ssa.gov, or you can, there's paper forms you can use as well. So we help people all the time sign up for Medicare. You wouldn't know it by my answer, right? But I thought you were saying you were already taking Social Security. But yes, when
and she is.
She is, yes.
He is.
Yeah, so he is. He's already enrolled in Social Security.
Hey, at least they see the human side of
Yeah,
us.
yeah. So I'm still, clarify me here. He's saying he is already enrolled in Social Security.
Exactly right. And
You're turning 65.
Medicare A and B is going to be automatic. Card shows up
That's
in
right.
100 days.
100 days before,
3.5
months out.
right
Yes.
before you hit
Yes.
65.
Yeah.
You're going to be automatically enrolled. Now you can answer question number 2.
Yes. So when you enroll, you're going to have that 6 months from your Part B start date to get that supplemental plan. So yes, you don't have to worry about it being open enrollment. Because you're turning 65. That's your IEP. So you just call and get the supplemental rates, and we can get that set up for you. Same thing with Part D.
Yeah.
So you have your own enrollment period because you're turning 65. So you're pretty much going to have 3 months before your birth month, and 3 months after. So you've got a 7-month window.
That's right. That's right. Yeah. So this open enrollment period is only for people that are already on Medicare.
Yeah.
And they have Advantage or drug plans. That's all. Okay. So you're new to Medicare. She's right. The 7-month window is yours. That is your open enrollment period. Okay.
All right. Can you enroll in a Plan G that is outside of the state that you live in? I live in Florida. So they're going to go by your primary residence, because it would be great, right, to go to one of those states that were less expensive. And if you're a snowbird, they're going to go with where your primary residence is, correct? Where you are more of the year.
Well, the question we have to ask, where will you be 6 months and 1 day?
Yeah.
That's your primary residence. So Erica's right. So that's the rules. Now, I've had people say, well, I don't know for sure. It could be split. Okay, well then you just tell me, we'll quote you both and you decide.
Yeah.
Yeah. But the official rules are 6 months and 1 day. That's your primary. So you need to be truthful about that.
All right. Regarding not being able to go from Plan N to G, is that also true for New York? That, I believe, has no medical underwriting when changing plans.
You're right. It does not include New York. In New York, you can do whatever you want. You have year-round open enrollment, no medical questions asked, so you definitely can do that in New York.
Yep, that's it.
Yeah. And that'd be the same for Connecticut, right? Massachusetts, Vermont, a couple states, New York, Connecticut, Massachusetts. But most states, you could not do that.
Yeah, those are the few open enrollment states.
Yeah.
All right, if I change supplemental plans and pass the medical test, is there a premium the same? Is the premium the same for everyone else who pays, or could it be more just for me? That's a good question. So if you go through the medical underwriting, and just know that's questions, right? It's just questions. It's not actual medical test. You could get approved, but they could charge you a little more. Isn't that correct, Marvin? Because of what you said in that underwriting process.
Is the premium the same? Well, the premium is the same rate for everyone that would be your same gender and your age and who lives by you. If you pass medical underwriting, they can't charge you any extra.
Okay.
There is one carrier that will actually, if you answer one health question, yes, then they can bump you up from a standard rate to a bumped up rate, which is about
Kind of a
double.
high-risk
Yeah, exactly
rate,
right.
yeah.
So, but most carriers, if they approve you, there's no different rate. There's
Okay.
not. This isn't. But one carrier, most people that would answer one yes health question is not going to go with that carrier anyways.
Yeah.
The rate's just too high.
And it never,
Yeah.
we always say it never hurts to try and go through
Yeah.
medical underwriting. It takes 10 or 15 minutes. Doesn't cost anything to try, so yeah, it's worth a shot.
Yeah, you will not be upcharged by carriers if they approve you. Everyone gets the same rate, gender and age. So that's the only thing that's going to vary, unless you live in community-rated state. Okay, let's keep going.
Final question.
Good.
All right, last question. What are the fees to use your service and to help a couple decide which plan is the best? I know I got this one tonight, so there's never any fees to you. So we actually are a broker, and we are paid by the insurance carriers. So we don't charge anything for you to call us. Most of our calls you set up with a guide are about an hour long, and we're happy to talk with you, tell you all your options in the area, and we'll never charge you a penny. And we're happy to help you out, but if you don't use us, if you use another carrier as well, no one should ever charge you for that. So they should be paid by the carriers.
Yeah. We don't have to work for free, but you don't have to pay us. Yeah. Insurance
win-win.
companies do, yes.
Yeah.
So,
Yep.
Hey, thanks so much for watching. Reach out to us if we can help. And then remember, every Monday we do this at 5 and every Thursday at 5 Central Time. Love to have you join in again. Tell your friends about us as well. We'd greatly appreciate that. Thanks.
Take care.